Hello, this is Damian Hamill, and I want to talk to you briefly about the use of hypnosis in managing pain. Hypnotherapy applied to pain management is a fascinating subject, and it was one of the most amazing learning experiences that I personally had when I started exploring hypnosis. Let me tell you a little bit about the first time I realized how powerful hypnosis can be in helping to control physical pain. I was probably in my late teens when I discovered to my delight that my sister-in-law, Liz, was a fantastic hypnotic subject. If you care to use the term, she was what some hypnosis pioneers would describe as a somnambulistic subject. She could rapidly go into extremely deep hypnotic states, manifest profound hypnotic phenomena, and then emerge from hypnosis with amnesia for what had happened. Now, all this was very good for the ego and for the confidence of someone who was just starting out in the field, and you may imagine my further delight when I found out that Liz was able to readily develop complete analgesia in her hands simply through basic suggestions. It rapidly became a party piece for me to put Liz into trance, hypnotically numb her hand, and then ask people to poke needles into it to prove that she could feel nothing. Liz indulged my interest in good spirits, even though she was often left with beads of blood on her hand and a certain amount of discomfort after I brought her back out of hypnosis and removed the suggestions for numbness. Looking back now, I thoroughly disapprove of these party antics of my younger self, but this experimentation in Liz's hypnotic responsiveness paid dividends when I was able to help her use hypnosis to manage her comfort when she tragically developed cancer some years later. Now, it's questionable whether I would have continued my interest in hypnosis had I not had such a remarkable example of its power at an early point in my explorations. But continue I did, and for me the ability of hypnosis to help people reduce or eliminate pain has been a key interest ever since. This particularly useful aspect of hypnosis has, of course, been a subject of fascination for researchers since the earliest investigations into hypnosis. You may be familiar with the British surgeon James Esdale, who pioneered the use of mesmerism, an early form of hypnosis, as an anaesthetic for surgical patients in his hospital in Calcutta. In the days before chemical anaesthetics, surgery was an agonising and horrific experience, and the mortality rate was around 50%. By preparing his surgical patients using mesmeric approaches, Esdale was able to reduce his mortality rate down to an incredible 5%. Fortunately, or unfortunately, depending on your perspective, the chemical anaesthetics ether and chloroform were developed not too long after this, and their ease of use and reliability made them a more appealing prospect to most doctors than the then comparatively unsophisticated hypnotic methods being pioneered by the likes of Esdale. The use of hypnosis in managing pain has, of course, persisted, and researchers like Ernest and Josephine Hilgard did considerable research on the subject at the Stanford Hypnosis Research Laboratory in the 1970s. In the modern day, we can see a resurgent interest in using hypnosis to manage pain and develop comfort in a wide range of clients who either cannot or choose not to use pharmacological or medical approaches to control their pain. Hypnosis for such clients can be empowering, safe, effective, and free of the side effects that can accompany drugs or other medical interventions. Personally, I find working with pain clients one of the most rewarding and fascinating applications of hypnosis, and I know many other hypnotherapists feel the same. Some hypnotherapists, however, would like to work in this field but don't feel confident about doing so. Although hypnosis for pain management is covered on many training courses, it is often touched upon briefly, perhaps just the classic glove anesthesia technique, and therapists may feel they lack the depths of skill and understanding to work successfully with clients experiencing pain. If you would like to develop more confidence in this field and have a toolkit of flexible skills and approaches to work with pain clients, even those experiencing the most troubling pain, we would love to hear from you. Just call us, email or visit our website at www.hypnoticoutcomes.com, and you can discover the training resources that can enable you to work in the field of hypnotherapy for pain relief with success and confidence. Thanks for listening.